Can I first of all welcome the fact that disability has finally moved after this length of time over to the Department of Children. And I suppose I just want to first of all maybe echo what Deputy Costello has said around the progress in disability. Parents have lost faith. They feel that it's a failed system. They're very discouraged. I'm hearing parents are getting service statements but with no date on them of when the services will be provided. And so, you know, others it's been told it's years, but they have no date at all. I mean, they're at the end of their tether. And I welcome the response you gave, but I mean, I don't think money's the real problem here. It's getting staff, and I think something has to be looked at. I'm just wondering, I've been told that one parent was offered the use of the National Treatment Purchase Fund to obtain an assessment, and they were informed by a regional manager in the HSE that this has been used by a number of people to gain assessments maybe for their children in Belfast or in Poland, and yet I'm being told in parliamentary questions that that's not happening. So just wondering if there's clarification on that. I'm just wondering, Minister, as well, you know, a very big budget has transferred over for disability. Does that include transport schemes? Because I know you're heading up a committee that's looking at replacing the mobility allowance and the motorised grant, and are they covered in that? Should they be introduced? Hopefully something will be introduced to replace the schemes that were over 10 years ago, isn't it, that they were suspended. Also, I'm just wondering, in a more broader sense, do you intend to review the Disability Act of 2005 to update it to a more rights-based approach? A lot will argue, including this committee, the Disability Committee, the Autism Committee, that it should be reviewed, especially the aspects of it that apply to the Epson Act. The two acts were actually supposed to work in tandem, and the Epson Act is being reviewed, but the Disability Act isn't. So I'm just wondering if there are plans to review it. In relation to just funding for services providing services for adults in the community, I mean, you indicate that you'll be looking at maybe some reforms around how they're delivered, because, again, I would come across a lot of adults who are not receiving any services. I was talking to a person yesterday whose husband had a stroke at the age of 37 1 year ago, and he's not receiving any sort of support. He got 2 sessions of physiotherapy since he vacated the NRH, where he was getting intensive support. And he's a young man, and you know, he needs stimulation, he needs physiotherapy, he needs OT. He's had no support other than the 2 sessions of physiotherapy. And I'm just wondering, MS Ireland have a proposal on a business therapy, on physiotherapy. They have a business case. Have they met with you, and would you be looking at that? I mean, they come in with the cost of 880,000 per annum to provide physiotherapy services for people with MS and other neurological diseases such as stroke and Parkinson's, and I think it's really needed because of the waiting list in primary care. And they reckon that a saving of something like 19 million could be made on people not having to go into hospital because of falls and so on. So they have made a good case. And I know I'm asking a good many questions here, but just even if I don't get time to the replies, I'd welcome written replies. Just on respite, Annalee House in Cavan was providing respite for people in Cavan and Monaghan, but because it was only house, it was alternative weekends for children and for adults. When it was closed due to renovations, necessary renovations, another house at Killygowan was opened. And I'm just wondering why, when Annalee House reopened, the 2 houses couldn't have been operated, one for children and one for adults. I put the question to the HSE at an Oireachtas and Health Forum meeting in January, and I was told that there was no reason the house was still available to them, but that the funding wasn't provided by yourself. So now the reply I got in a PQ on this issue indicates that there are new services opening, which is very welcome, but you know, it doesn't make reference to that, so I'm just wondering just what the situation is on that. And just, I suppose, one other thing is that a lot of services receive funding year on year based on what they received the year before. Services need multi-annual funding so that they can actually plan ahead, because the funding is often delayed till February or March of, you know, into a year before they know exactly what funding they received. But at the same time, it's given without any oversight of what service was provided in the year before. So there seems to be little accountability. So I'd love to see multi-annual funding to services, but a lot more accountability on the service provision, and that it is meeting the needs of those that require that service.
The local issues.
Thank you. And I'm sorry.
So look, you're absolutely right, Deputy Tully, and it's similar in terms of what Deputy Costello spoke us as well in terms of the lack of faith that parents have in PDS at the moment. And that is entirely understandable, and it's something I know Minister Rabbitte has experienced on a national level as she's gone around and visited parents groups and met with them around the country, and it's something I see in my own constituency as well. And you're right, on this issue, the issue isn't money right now. There's two issues, and you identified the most important one, the lack of staff, but there is a need to reset the relationship between parents and the HSE and the individual service providers as well. And some of that will come from when there is more staff, because those staff who are there are under immense pressure, and we have to recognise that. But there is, in terms of even how parents are written to, and indeed, we get the letters as well when we advocate as constituency TDs, and you could read, when someone's not getting a therapy, you could probably call out what the letter would be, because we've seen them all so many times as well. So there has to be a recognition that this isn't pro forma stuff. This is parents dealing with the, some of the most traumatic experiences in terms of their concern about their child that they ever will, and we have to change attitudes there. And I suppose, and probably spoke earlier on about, our welcome for Bernard Gloucester taking over the helm in the HSC, and someone we know who's dealt with issues in terms of TUSLA incredibly sensitively, and we hope to see that culture continuing to grow and develop. And in terms of addressing the issues of staff, what myself and Minister Rabbitte identified even before the transfer was the need for the HSE to set out a clear set of actions that would be taken in the short to medium term to show parents, to show elected representatives that we are moving back on track in terms of the delivery of PDS. So that's what the roadmap is. We're looking to see that published soon. It contains those proposals in terms of how we get more staff in. Some of them are medium term in terms of more college places for speech and language, for OTs, for physiotherapy, for psychiatrists, but some of them will deliver in the shorter term in terms of conversion courses, master's courses, and how we actually fund those, recognise that they're expensive, but if we can get someone in to take them up, let's see if we can actually fund those. So it's a range of issues to try and deal with those staffing issues so we can move away from that 34% vacancy rate nationally at the moment, which is such a barrier in terms of the delivery of services. In terms then of your point on a revision or a review of the 2005 Act, we're working at the moment in terms of our work plan. There's about, we've about 20 months left probably on the outset of this government, and there are a range of very important issues, many of which we've discussed at this committee, or the disability. We've the PDS roadmap, which needs to be delivered. We've the action plan on the capacity review, which is all about setting out how we get the investment across the entire sector, not just in PDS. With the European Accessibility Act, we've the discussion about do we look to progressing the ratification of the optional protocol. With the autism innovation strategy, with the new disability inclusion strategy. So there's a lot of work there, and I suppose we've a job of doing a prioritising. I like to be as upfront, and Minister Rabbitte does too. We're not going to get all of those things done in the next 20 months. So we have to prioritise in terms of what are the most important elements in terms of delivery, and we're committed to service delivery. That's what has to be so important, because we've fallen so far behind. So look, we're happy to listen to yourselves in terms of input on that, both this committee and the Disability Matters Committee, but there will have to be a prioritisation. And everything that we all want to do, we will have to priorities in there, because we won't get everything done. The move to this department is the start of a new process, but it is only the start, and it'll, whoever succeeds us as ministers will have to take up that baton. But we want to get some of the basic work done in our time here.
And I'll start first with the good stories. So the good story is in relation to the neuro teams, which was announced in the budget. And I think that speaks a lot to where MS is coming from Parkinson's. The community neuro teams is really about putting services into the communities. So two things happened in this year's budget. One was the clinical neuro nurses going directly into the acute settings. There was 28 of them, and there was the community neuro teams. And that really is about that multidisciplinary, interdisciplinary approach within the community and working across, regardless of whether it's MS, Parkinson, Huntington's disease. In actual fact, having that really good, proper team in operation is what's needed. I'm ambitious for the fact that we don't need just 2 or 3 of them. We need one in each of the RHA areas as it's unfolding. And we need also to have teams that we can expand and actually work on the various specialities of it. So we're working very closely with Brian Higgins in the HSE. He's leading out on the reform piece. The neuro mapping was done last year, which we funded. So the neuro mapping, which has been done with Mags Rogers in AI, along with the Disability Federation, along with the HSE. So there's now a clear understanding of what the need is. It's been funded. 2 teams have been funded this year. There is also the conversation around CHO6 and CHO7 that were funded back in 2018, that those teams haven't been properly stood up. We're getting under the bonnet as to why that didn't happen, and we're working with Brian in relation to getting that funding spent and getting them operationalised. So the ambition would be by the end of this year that we would be talking about having 4 teams in a position around the country and then finishing off what needs to be done. So that speaks to all the various disability groups around, the very small ones and the larger ones. In relation to the transport, we finished that piece of work in relation to transport. So any funding which is within my budget of the 2.5, of which 44 million, believe it or not, is spent on transport. That has come across with me. Transport that is being provided will continue to be provided. But we're also talking to the Department of Finance, the report is sent across, as to how we can have a more targeted support to address a lot of the needs that we're all acutely aware when it comes to disability. In relation to service statements, look at what you're describing there is no different to what Patrick would describe, no different to what Padraig would describe. It's a hit and miss. Some CHOs give very detailed service statements and some others don't do as detailed as, and some don't have dates on it at all or don't do them. To be quite honest with you, it's very important to know actually what is to be achieved, but it's also the intervention is what I'm really focused on. That intervention to me and the continuation of interventions is the most important. I'm not a big fan of ticking of filling out forms and filling and repeating. What I want to see is actually therapists actually delivering on interventions. That's what we need to focus on. Children need the interventions in a timely fashion, but there's a variance as to how service statements are being done and not being done. And finally, and it's a really important point you're after hitting on in relation to respite, and all along, so respite, you talk about Cavan Monaghan. I was down there. Cavan Monaghan, it's 1 week children, 1 week adult. It's not good enough, and it's also there is such. The county is quite big. Both counties are big, and to think that they have to be interchangeable between the 2 counties and to have buildings not in use is not correct. And to say that if there's need for funding, that can be stepped up. And yes, we take in consideration that there is an issue with recruiting of staff. So if we just take that, there is a lot of children and there's a lot of adults that needs access to respite. And in actual fact, that's a priority for myself, it's a priority for Minister Gorman to ensure that families can have access to services. If I hear of any building, and I would appeal to any Oireachtas member that knows of any building that is standing idle, not in use, that is a designated respite house, please come and tell me. And I will work with the local CHO as part of our business cases to make sure that all of our respite houses are operationalised and we don't have any vacant uses. That to me can't be happening. I would also say to the local HSEs that where we have time-related savings, that would be one way I would encourage them to spend some of their time-related savings.